The Health and Retirement Study is a NIA-funded cohort study of about 20,000 people across the United States. We follow people who are 51 and older, do interviews with them every 2 years to ask them a bunch of questions about their health and wealth and family. We also collect biological information on them, take some blood. We get their Medicare records and Social Security records. The big picture is to try to put all of this different kinds of data together to understand aging and how can people age successfully, both from a health and a family and wealth perspective. And it's been going on since 1992. Again, we collect data every 2 years and follow people until they die.
Okay. And you pick up people after they turn 50?
That's right, yeah. So we enroll people at age 51 to 56 is sort of when we get them into our study. Every 6 years we backfill the sample, so to speak, get a new cohort of 51 to 56-year-olds, and then, again, follow them as long as they'll let us or until they die. So we started collecting actual biological material, blood to be specific, in 2006, and that sort of expanded over time. We also collect genetic information, so we've got the genetic profile of almost all of the respondents. We now also collect a full venous blood sample. Initially, we just did a finger stick to get a few blood biomarkers. Now we collect a full, just like going to a doctor's office and collect tubes of blood and look for a lot of more different kinds of things in the blood. So we did a supplemental study of dementia in the early 2000s called the Aging Demographics and Memory Study, or ADAMS. And in that study, we went to about 850 people's homes and did a very intensive neuropsychological exam, neurological exam, collected lots of information, presented that information to a panel of clinicians to sort of make an assessment of, does this person have dementia and is it caused by Alzheimer's disease, or do they have mild cognitive impairment? That study has been very valuable and used widely, but was also very expensive. So more recently, the National Institute on Aging, our funder, asked us to try to think about a more cost-effective way to collect information on people's brains and how it's working. And we're now doing that. It's called the Harmonized Cognitive Assessment Protocol, or HCAP. And in that study, we are now collecting about an hour's worth of cognitive information from the respondent, the person in the study, as well as about 20 minutes of information from someone who knows them well, a spouse or family member. Those data are now available and coming out, and the exciting additional aspect of that is that there's countries around the world, now about 7 of them, that we partner with that are doing a similar kind of dementia sub-study. So again, the big picture is to try to understand how people's brains are aging in different countries, both low and middle income and high income countries, compare rates, compare risk factors across these countries to try to have a better understanding, again, about how to keep people's brains healthy, how to keep them healthy as long as possible. Yes, the first wave of data were collected on about 3,500 people within the HRS in 2016 and 2017. Those initial data are now at the HRS website. Other countries, including England, India, Mexico, China, South Africa, soon the European Union and South Korea will also be collecting data. The data from Mexico are now out. The data from England will be out soon. And then we'll actually collect a second wave of data in 2020 on these 3,500 people, getting more information and looking at change over time in their cognition and how they do on these cognitive tests. Yeah, so I think there's actually been some very optimistic findings in a growing number of studies around the world, mainly in high-income countries, that suggest that the risk for dementia has actually declined a bit over the last 25 years. We've, again, done studies in the United States. Other groups have done studies in the United States that suggest that an 80-year-old today actually has a lower risk of dementia or Alzheimer's disease than an 80-year-old 20 years ago. And We think that some of the reasons for that is that there's been a big increase in the level of education in countries around the world, including the United States. Education seems to be very protective against dementia for lots of complicated reasons. And it also seems like we're doing a better job of treating important cardiovascular risks, things like high blood pressure, high cholesterol, diabetes, which also we think has decreased the dementia risk over time.